Before we had Enovacom Patient Connect, there was a significant risk of associating the wrong patient details with the wrong patient record because the system didn't in any way require patient identification. Additionally, the fixed points of care worked variably. If there was even a tiny error in the system, the data wasn't recorded or transferred anywhere for safekeeping. Some of the data also had to be written down manually. Device integrations with clinical systems weren't a new thing for us, but they all worked a bit differently, which really didn't support our staff moving a lot between different wards. The goal was to fully evaluate the integration capabilities and needs of all the devices at the acquisition phase. Some integrations ended up being left out due to lacking solution architecture or failed cost evaluation. The biggest difference with Enovacom is that it's based on an application-level interface. Before, we had application-specific drivers. Challenges were related to the fact that we had to have discussions with every supplier regarding new drivers, new devices, and we would need to test them ourselves to see when they work and when they don't. There were also varying levels of technology depending on the monitor generation.
Hospital Nova's wish and goal was that the patient journey in the hospital would be modernized. For example, when a patient arrives at the emergency room and is associated with a patient monitor, then the same monitor could follow them throughout their path of care. It saves time for the nurses in a rush, and it's more comfortable for the patient. Enovacom co-developed a solution for that with us.
Enovacom's integration platform changes things in that now we have a unified method of device association for devices in both wired and wireless networks. In terms of resources, this kind of unified approach makes working easier. The app is on every phone we use in the ward. In practice, you scan a QR code from the patient's wristband, ask for their social security number, so we get two-step verification, and then the application connects them to the patient record and data transfer begins. One of the advantages of the mobile application is that it associates the patient identifier and the device, and all the monitor data is then transferred into the server based on the patient identifier. Because of this, patient security is increased as data goes into the right place based on their social security number.
Another way to do the patient association is with a so-called contextual call, which Hospital Nova uses, for example, in the intensive care unit. For this, the patient wristband or device are not scanned. Instead, the Enovacom app is used on a desktop computer, which shows all the devices near the patient as a list. And Enovacom's system associates the devices and the patient data with the patient record via one path.
Now that we have done this work once, we have an existing interface and can identify at the acquisition phase that these monitors will need to connect with this interface. And the interface descriptions are already in place for Enovacom's solution. We believe that with Enovacom's solution, we can evaluate integration possibilities and costs more accurately and cost-efficiently.
Cooperation with Enovacom has been excellent throughout the process. And this process continues. OneMed has signed what they call a cooperation and development contract with Hospital Nova for 10 years. And Enovacom is one of our partners. For the future, we have discussed several issues. We have discussed home care and connecting the devices at patients' homes to the same system. There have been discussions about healthcare centres in certain welfare jurisdictions connecting their medical devices to this same Enovacom system. So, our cooperation continues from now on as well.
Now everything happens wirelessly. When the patient is moved and the monitor is moved from the docking station, the patient's data is saved and data collection is continued at the next place of care, like when moving from the operating room into the recovery room. The patient isn't required to be reconnected into their bedside. This saves approximately a minute or two per patient. Everything is easier to manage. Changing or removing a device group or clinical system doesn't affect the overall system. Another advantage with the mobile application is that we can associate wireless and wired devices with the patient at bedside, which means that the patient's social security number can be associated with a mobile monitor, which follows the patient through their path of care. This only requires the device association to be done at the initial point of contact with the patient. This is a universal solution. As we have various endpoint applications, we can serve all of them with this one solution. One of its key features is its adaptability. There's a single solution interface and it serves several input sources. Bringing the patient ID into Enovacom's system allows us to be certain that the measured parameters are associated with the right patient. This makes the big picture more manageable. This is significantly easier for the end user. Overall, the documentation quality of patients has improved with this solution. There are fewer errors when having to handle them, so work is more efficient. With this solution, we should be able to manage for the next 10 years. First of all, the application is easy to use and available for mobile devices. It's also reliable. When the patient has been associated with a device, it has continued to work well afterwards. Additionally, there's no more need for manually writing down data, as all data is transferred automatically. And most importantly, now the patient's identity is confirmed every time the patient is connected into the system. Using the EPC app has been easy and has become completely routine. I wouldn't want to return to the way things were before.